Good morning, Carol Johnson.
And a good morning to you, Bob Ponce.
All right. So we are live once again for our Harlem Emergency Network COVID update. We've been doing this for, I guess, we're in our second year now, believe it or not.
Yeah.
Hopefully, we don't get to a third.
Yeah, you know,
Yeah, I look forward to the day where we have a retirement show where we don't have to do this anymore.
yeah, that
But
would be lovely.
meanwhile,
That would be so lovely.
yep. So the big news since our last show is that Johnson and Johnson vaccine is back. So the CDC met last week to go over the issues they had concerns about regarding the Johnson and Johnson vaccine, and they weighed out the risks versus the benefits of vaccination and a resumed vaccination. Now, as far as we are here in Harlem, I think we're at the same place when we left. Is that there? As far as we know, there's no locations for Johnson and Johnson yet. I think we will check in and find out what happened with the fire department program because we know they were supposed to be doing home vaccinations for seniors. And I don't know where that's left, but we will try to find that information out for you guys by the next show. In the meantime, just to kind of review with people what happened with the Johnson and Johnson vaccine, they found a risk of certain types of blood clotting that primarily occurred in women ages 18 to 49. Out of like 7 million vaccinations, they had 12 cases and they had 3 deaths. So it was enough concerning that they wanted to check it out. But again, the risk is low in most people. But women ages 18 to 49 should pay attention to it and consider whether they want to use Johnson and Johnson's versus Pfizer or Moderna. Specifically, if you had issues with a certain type of what they are calling thrombosis, which is an immune mediated syndrome, um, and it's specifically if it's heparin induced thrombocytopenia, they
Mm,
should say that anybody who's had this problem should avoid the Johnson and Johnson vaccine in the immediate aftermath of their illness. This is according to CDC staff. So if you've had any of those types of problems, or if in general you just are in that particular demographic, you might want to look for Pfizer or Moderna. Remember, of course, that the Johnson and Johnson is a one shot versus the others, which are a two shot, and so that's obviously been a factor for some people.
right. And that's basically, if you have health concerns and you have some health situation that creates clotting, blood
Hmm.
clots. So, you would automatically want to certainly speak with your doctors, um, and for now, steer clear of that. Also, it just goes to show that vaccines weren't created and then put on the shelf and just left there. All of the vaccines continue to be worked on. Um, one, to see if we need to be vaccinated again, if we need a booster shot, if it's something that we need to get an additional shot every year, like the flu vaccine and the pneumonia or the shingles. So it pretty much would operate the same way, but they're not sure. However, Moderna has begun to prepare um, doses in the event that we would need a booster shot or that third shot, like 6 months from now or another year from now. So
Hmm.
it's a constant reminder that there are a lot of things that they still don't know, but they are consistently 24 hours. They're in the laboratories and they're trying to figure all of this stuff out and get it out to us as soon as they seem that it's feasible for us to know.
Mhm. And just want to remind people that there are walk-up vaccination sites in Harlem. One of them is the Abyssinian Baptist Church, 132 West 138th Street. They're available between Tuesday and Sunday from 9 to 5, and they have the Pfizer vaccine. We also have City College, and they are available Thursday through Sunday, 9 to 6, and they have the Moderna vaccine. And also further way uptown, you have Yeshiva University, 2495 Amsterdam Avenue around 185th Street. They're open Sunday through Thursday, 9 to 7, on Fridays, 9 to 5, and they have the Pfizer vaccine. And there are also vaccines. You can get scheduled appointments at some of the Walgreens and Rite Aids in Harlem. We suggest you check the vaccinefinder.nyc.gov, and you can put in your zip code and find the locations that are closest to you.
Yeah, so it's moving along. It's not still not where we wish it were for the village of Harlem, particularly East Harlem, but it is moving along. It's interesting because you know, every time something happens, people just take it and they run with it.
Mm-hmm.
So people say, "Well, I never trust that Johnson and Johnson anyway because of the baby powder, situation." And I'm like, do you know how
Right.
many medications are out there made by these different companies that people have problems with?
Mm-hmm.
You know, and what if we have to take the vaccine more than once? You get the flu shot more than once. You get the flu shot religiously every year. And remember, vaccines work on the same principle. We are now told that if we're in a vaccinated household and we want to mix with other people who are fully vaccinated, that we can do that, in indoor spaces. We can relax our masks. But when we're around people and we're still not sure, you know, um, then we need to still maintain that social distancing and we need to continue to wear the mask and wash our hands,
Mm-hmm.
regardless.
We also want to remind people that there is a place that you can report vaccination problems. Again, these things have been rare, but it's important that if there is a problem, you report it because we want that information from our community so that we can have an early warning system if there are problems. It's the Vaccine Advanced Early Reporting System called I don't know if they pronounce it VARS
Acronyms.
vars.hhs.gov. So you see the location on the screen. Just that go to that address, and anyone can report. You don't have to be a doctor. Anybody who's had a problem, or if you had a family member who's had a problem, just remember you are reporting to a federal agency. And so make sure you tell the truth because lying to a federal agency is a federal offense, and you don't need that.
Yeah, I'm happy to report that I had my second shot of Moderna on Monday.
Congratulations.
Thank you. And I had I didn't feel either shot. I felt nothing, not even a pin.
Mhm.
But I just like had a little bit of soreness on the after the last shot. But that's basically when I move my arm. If I don't move my arm, like now, I don't feel it. You know,
Mhm.
and when I do, it's not enough to take anything. It's not even a consideration of, getting a cold pack or a Tylenol or anything. So now I'm at like the 48-hour point and I've had no symptoms, whatsoever.
Mm-hmm.
Except for that first day. Now, I did become voraciously hungry. It seems like I was just grabbing food from all over the place that
Mm-hmm.
first day. But after that, I felt nothing, you know. And I want to be clear when I say that. I know people are asking people, well, what did you feel? What side effects did you have? This vaccine adheres itself to people's bodies differently. It could be the same vaccine. We could take the same thing, Moderna. It's not going to react in my body the way it's going to react in yours.
Mm-hmm.
So don't base whether you're going to get it or which one you're going to get based on. Well, I don't know anybody that had after effects from Pfizer, so I'm going to take Pfizer. Make a responsible decision and know that it depends on the individual how that antibody builds in you. The other thing is we've been building our immune systems this entire time. This throughout this entire year. We've been constantly working and keeping our immune systems intact. That may be one reason, you know. But the other
Mm-hmm.
thing is that we just gotta make sure that we get lots of sleep the night before.
Yep.
Make sure when you go, the day that you're going to get the vaccination, either one, that you make sure that you're very well hydrated and that you eat before you go. Get that really long, restful night before. Make sure you're drinking lots of fluids that day of, and you're doing it on a full stomach.
Mm-hmm.
That will help you absorb it as well as help the antibodies build.
Yep. So I also wanted to share this story that comes out of Michigan, where they're talking about how their COVID wards are now filling up with younger patients. And so this is something that we've obviously talked about, that younger people need to be cognizant of the fact that they haven't figured it out by now, that they're by no way immune from this, and they need to pay attention to it, because a lot of times young people are just ignoring the protocols, and that's causing real issues in Michigan, where they're just seeing younger and middle-aged people who have they're showing up in the hospitals. And so that's not, as far as we know, we haven't seen that kind of outbreak here, but it's definitely a potential for it if you're not basically doing something to protect yourself.
Yeah, we have to remember, the spring breaks and, kids coming in from all over the place. And, you know, if there's any young people listening, you got to be aware of the fact that you may be going off and partying, and people, they're drinking and they become less aware of things, you know, their inhibitions start to pop up and they stop wearing masks as if they were wearing them at all, and they're crowding together. Also, I mean, one thing that we've seen in New York from the onset, even when we were knee deep in this thing, that groups were still trying to gather, that 20, 30, 40 something crowd. When the
Mm-hmm.
bars began to open, they had to start closing the bars because so many people were piling up on the sidewalks, drinking, and socializing, that you couldn't walk down the streets.
Mm-hmm.
You know,
Mm-hmm.
they sort of have this thought in their heads that they're immune, and you're not.
Mm-hmm.
When these articles are coming out to remind us that you have to pay stricter attention. And at the same time, if you live with someone, an elderly parent or relative, be cognizant of the fact that you could be bringing it back to them and still be asymptomatic. So,
Mm-hmm.
we're trying to get on the other side of this thing. So if you really want to know, now that so many people are becoming vaccinated, we're getting closer and closer We're still a ways off to
Mm-hmm.
that immunity. We really need to pay attention to keep us from reverting back to where we were.
Mm-hmm.
So don't base it on, well, all my people got vaccinated, so I'm not going to bother. We need to get to a certain point.
Yeah. Yeah.
So we'll be weary for years and years and years and years. People are tired. I get it.
Mm-hmm.
They're tired. I get it. But we're going to be in that position for years and years if we don't do what we need to do in order to get to the other side, get over this hump.
Yeah. And, and you see this quote from a doctor, an emergency room physician in Detroit. He's saying he's putting more patients in their 20s, 30s, and 40s on oxygen and on life support than at any other time in this pandemic. And the experts are thinking this has something to do with the variant, the B.1.1.7 variant, which is more contagious and more severe, and it's spreading rapidly among younger groups. So, protect yourselves, folks. Protect yourselves
Yeah,
and protect your family.
that's the bottom line.
Mm-hmm.
You know. And I think we've been in this way, way, way too long to
Mm-hmm.
still have to explain to people what's necessary to be done. So please stop, adopting that. Well, I'm tired and I'm just not going to wear a mask. Well, you're going to contribute to us having to wear them even longer with that behavior, considering how many people, where we would be if all of the states and the governors had put these mandates in place and said you must wear masks, we would be in another place. But they clearly showed us by not doing that and by not um, getting serious about. Listen, you criminalize these people. You're breaking a law. Create a law that says
Mm-hmm.
these are the things that you must do instead of just saying, if you want to go ahead, if you don't,
Mm-hmm.
we would be in another place. But we've got another chance now because of the vaccines to really push this forward. So this is the time to really be, on your P's and Q's. And in
Mm-hmm.
some ways, even to a greater degree than we were before.
Mm-hmm. So that's about all I have to talk about this morning. Anything else on your mind?
No, I'm good.
Mm-hmm.
I'm good, but for those that's been in there, we see our brother Mark McPhee, who's always on board, our
Mm-hmm.
head colleague, the man about the streets. Boots
Mm-hmm.
upon boots upon boots. He doesn't wear one set of boots. He wears like 5, 6, 7 pair of boots at one time. And he's
Yeah.
the man about town. So, we want to give a shout out to brother Mark McPhee and all of our colleagues at Harlem Emergency Network and our connective partners, Department of Health, Department of Mental Health and Hygiene, New York City Emergency Management, and all those people that's been working with us diligently throughout this time. Let them know we're still hanging in there and we're trying to stay on top of the game. And to our brother Wale Abdul Noor,
Yep.
who got all of this thing started. If it wasn't for Wale, we wouldn't even be here. Well,
That's
I know I
right.
wouldn't be. Let's put it
Well,
like
me neither. Me neither.
that.
Yep.
So
Yep.
we got
So
very, very, very dedicated people. Brother Haja Wally, who's also a community warrior, making
mhm.
sure that fresh fruits and vegetables was available throughout the pandemic, for such a minimal fee.
Mhm.
I was getting bags of veggies, like 2 bags of vegetables for
Mhm.
like $5. You
Mhm.
know, 4 ears of corn for $1. You couldn't beat that
Yep.
to save anybody's life. And our Wonder Twins, we call them. Reverend Dr. Nesta Vanoy and her son Raheem Vanoy. So we have been here and we've been doing this diligently for a few years, and we're gonna keep it up.
Yeah,
We're gonna keep it
absolutely.
moving. Did I leave anybody out?
No, no, that covers it. But also just a shout out to all the different community organizations and activists that have worked so hard during the pandemic, food distribution, and just people have looked at so many different aspects of it. Remember some of the groups that were looking at the issues of homeless people and who were taking care of their needs, and there's so many different variations of and niches in our community that need to be taken care of. And just a shout out to everybody involved in community activism work to keep people safe and share information. And so we will continue to do what we do, get the information out, not just on COVID, but anything that impacts the safety of our community. And we appreciate you listening, and share the information, spread the word. And God willing, we will be back next week at the same time with an update for you.
Absolutely. So have a blessed week. Stay safe. Remember, stick to the protocols, and we'll get through this thing together.
Right. And remember those protocols. Nobody got the flu this past year because the same protocols kept people from getting the flu. So keep washing your hands, keep using those masks, and you don't have to be all up on everybody, and take care of yourself.
Until next week, take care.